So we had our first discussion group meeting back in February where we introduced the topic of our research, which is primary care patient safety, focusing on people who have multiple health problems.
No, you're quite right.
Unfortunately.
I got involved in research simply because I feel that if we're going to make any progress in any sort of medical manner, whether this is actually treatment of patients or whether it's actually cure or drugs, we've got to have research. And research isn't sort of necessarily the mad scientist with his great big file and bloodstained robe. This can be a relatively calm discussion around a table, and people talking about their experiences, and then finding possible ways that the patient experience, which is the only way to describe it, can be improved.
I find it very interesting, mainly because I get other people's opinion, and it's also helped me in that the experience I've had, that I wasn't alone in that experience, and anything that can be done to improve people's experience is very important.
I find it quite stimulating because we've got a group of people who are all suffering from different conditions, and everyone by definition has got at least two, and it's quite interesting to hear how other people cope and how they find things.
Inevitably, through networking as we are, you hear an awful lot, and you can't hear too much about health. You know, they say Englishmen just discuss the weather as a general topic, but I think health should be substituted for health.
On a personal level, I would say it's been very useful just to realise that we are not alone in any problems that we have, and lots of people have a lot worse problems, but it's nice to share ideas with people and share problems and just the general discussion. I think that's the case whenever you are in a discussion group. It's often what the other people have to say as much as the presentations, etc.
In what came out of the first meeting that was focused on patient safety in primary care was that communication was really the cornerstone of everything to do with a person's health.
And I think patient safety boils down to communication, and I'm very passionate about communication, and in fact used to teach communication at the MMU, and the people who need to be taught are those that think they're already there.
My view is that everything stems from communication. A lot of people may not agree with that. They think that it's more important to have the latest piece of equipment or to have the latest information on new drugs and trials and research. But whilst those things in themselves are important, without communication, nobody gets to know about them.
And that was communication both between patients and their care providers, between different care providers, and I think between patients and support networks as well. So that might have been family members, carers, or support groups.
Have you got a free spot, Gavin?
Well, I was.
Don't worry about it. Yes, I feel that the review of medication is insufficient. You could be on something that you don't need to be on any longer, if you need to be on it at all. But the thing is, okay, the GP is, we assume, doing his best and putting you on some medication for your own good, but the question is, do you need to be on it so long term?
I think the most important thing in patient safety is to remember that there are, especially in the older generation, people that don't understand their medication, and it can cause problems. Some may have the starts of Alzheimer's, they may forget to take it, or they may take it too often or too many times. And there are also still a lot of people in the older generation that can't read. So they can't read the patient information leaflet. So I think that they should have help in making sure that they understand what the medication does and how they should take it.
I think at one time most people, you sort of think to yourself, your GP is God. His word is sacrosanct. If he said you've got a broken leg, you've got a broken leg. Well, nowadays you tend to think, hang on, I know what my leg feels like. It ain't broken. And this applies to a lot of drugs too. I was at a meeting, the heart group I'm a member of, because I have a heart murmur. And the guy was talking about everyone over 50 ought to be on statins. And the question was asked from the floor, are your family on statins? To which the man said no. So, immediately we all agreed none of us would go on them unless we were absolutely forced into it.
A lot of the ideas for getting more involved in care seem to focus around self-management and things that people could do to manage their conditions, but that crossed over quite a lot with relationships with care providers and how patients and care providers engage within appointments, and also related to patients getting more support from carers and support groups and care providers beyond GPs and doctors.
Yes, I think patients should very, very much take on responsibility for their own care as much as they can. Obviously, some people are not able to do that as much as others, but I think really that's where things should start, with patients becoming involved, listening to what they've been told and acting on it.
Patients should be involved in their own treatment, because if they don't think it's great, they're not going to take the medication. They're not going to take the pill, they're not going to do the rest, they're not going to do the exercise, whatever it is the doctors specify for them, unless they believe in it. So it's the old business of the bedside manner, I suppose is the best way to describe it, that you trust that doctor, or the GP, or the local nurse, whoever it is, the medical person who is looking after you.
Patients have got to be involved in their own care, and I think I may have said to you that on a previous occasion, I'm the only person who knows how I feel. If you don't listen to me and you don't believe what I'm telling you, or if you don't believe what I'm telling you is rather better than I am, then we're not going to get to a satisfactory resolution, because you won't know how I feel unless you actually listen and understand to what I'm telling you. So yeah, right from that bottom line, you've got to be involved in it. And if I come to you and say, look, this treatment you've offered, you've told me to take, A, isn't working, and it actually makes me feel even worse, then you've got to take that seriously.
Patients have a responsibility to themselves to actually learn as much as they're capable of learning about their condition and how it's managed. I mean, I know not everybody's got access to Google, which gives you lots of patient.co.uk information, but there are plenty of places you can pick leaflets up from.
Well, obviously it's immensely helpful, not only to the patients, but the NHS as well, to sort of cut costs if the patient contributes as well. Yeah, it's diabolical if the patient doesn't contribute to his own care and well-being. Absolutely. And he shouldn't just depend on the NHS for that. He should do his own research, take an interest in his own health, and pick up information that surrounds him. You can always get information, whether it's on the internet, albeit, well, you have to be careful about it, or the abundant literature that there is about. You go to a hospital, there's loads of pamphlets and so on. You go to your GP surgery, there's loads of pamphlets there, and you should read those that certainly you think apply to you, so you're informed.
Listen to advice, make sure lines of communication are open, and if you don't think you're getting where you would like to go, persevere, and don't just let things drop. Persevere.
I think the main thing is that these patients with problems will have carers, and the medical profession should listen to the carers, which in most cases they don't. listen to the carers and also explain to them what's going on so that it's not all down on the patient with problems.
Yeah, I think I was actually quite surprised at how ready people were to take on the idea of becoming more involved in their healthcare, and it seemed a lot like people were sharing ideas for what they've done to be more involved in their healthcare or to support others in healthcare as well. So that was nice, kind of to have a sharing of ideas. I think people do seem happy to get more involved because I think one of the comments related to it being about your own healthcare rather than the healthcare professionals, so that, you know, it is, the word responsibility wasn't used, but it is kind of to say that patients can become more involved in their care, that it isn't just about following instructions from other care providers, that there's a lot of things in your life that you will be aware of about your health and safety that your care providers might not be. And so there's a lot of things that you as a patient or a carer can do. And it was good, I think, from my perspective as a researcher working in this area with the intention of developing a resource for patients and carers, to hear back from a group that would be something that they would be interested in and that they would be happy to get more involved in their care and do different things.
I would love to. I think it's a very, very important thing that patients get involved, that patients know how to get involved, and that patients are actually being listened to, and that something is going to be formulated out of it, which hopefully will then filter through to the doctors and the nurses and, may I add, the GP receptionists. And with a bit of luck, the patient might become the centre of attention.
Anything that I can do to help the future generations, which is important in my opinion, whether it's a research programme that's looking at ways to improve treatment, or whether it's something like this, is something that I want to be involved in. I've got the time to do it, so yes, I'll do it.
I really value the discussion group as a way of being able to share the ideas that we're coming up with within the research team with other people, and to check with the people who would ultimately be using any resources that we develop whether or not we're on the right lines. Like, are we researching things that are of interest to them, that they would want to use, and that make sense in terms of their needs and priorities and what's important to them. And it's really nice to actually get to be in a room with people and have a two-way discussion, sort of share our ideas and listen to other people's ideas and see where we meet and where we don't.
Have you got the free spot, Gavin? Well, I was.